There are 2 exercises I recommend you avoid if you have knee pain. My name is Roxanne Meldrum and I'm a physical therapist with PT Health Academy. The first exercise I would recommend that you avoid is a seated knee extension exercise. This includes anything where you put a cuff weight at your ankle and kick out straight, or the knee extension machine in the gym where you kind of slide your ankles in underneath a weighted pad and you push out against the weight. A relative of this exercise is a seated short arc quad exercise where you put a bolster underneath your knee and simply extend through that last 20 or 30 degrees of extension, again with any kind of weight at the ankle to add resistance. There are 2 reasons why I recommend that you not do this exercise. First, there is a lot of compression and pressure between the kneecap and the groove that it slides and glides in with this exercise. So if you have any roughness or irritation on either the surface on the back of your kneecap or in the groove in which it's sliding and gliding with this exercise, this can really aggravate those surfaces and make them more angry or more painful. Second, while this exercise does a really great job strengthening our quad muscle, it strengthens it in a way that is not useful to you. So we build muscle in the manner in which we train it. So in this particular exercise, you are training your leg to kick really hard in sitting, which is not going to help your knee be stronger for stair climbing or hiking or squatting. The second exercise I would recommend that you avoid if you have knee pain is any exercise that recreates the pain you are trying to treat. I know this sounds like common sense, but I see it all the time where people try to push through pain to build strength in their leg or in their knee to try to help prevent or treat the pain that they're experiencing. This rarely works. A dear mentor of mine uses this analogy that you might find helpful. If my hand hurts because I'm taking a hammer and smashing my hand with it, then continuing to smash my hand with that hammer is not going to make the pain go away. Stopping the hammering will. It's the same thing with exercise. There's nothing wrong with trying to strengthen around a joint that is painful, but if you're recreating the pain that you are trying to treat, it's not likely going to get better. It's also important to understand that pain is a muscle inhibitor. So if you're doing an exercise to try to build strength and it's painful, you're actually going to shut the muscle down, not help to build it up. The one caveat to this is that if you're doing an exercise where the first few reps are painful and then it starts to get better, it's probably okay for you to continue. The increased blood flow and nourishment from the exercise is probably helping whatever problem is going on in your knee, and therefore you can continue with the exercise. I hope you found this tip helpful. If you did, please like and subscribe. It really does help my small business grow. Thank you so much for your support. Thank you so much for listening.